Across the Asia-Pacific, extreme weather is putting communities and health systems under increasing pressure. Now, South Korea has endured a record-breaking heat wave of dozens of people reported dead, and the elderly among the hardest hit. In China, Typhoon Dolphin has brought torrential rain and flooding, forcing more than 1 million people to evacuate. And over in the Philippines, monsoon rains have triggered widespread flooding and landslides. The health consequences are becoming harder to ignore, and those pressures are coming now in focus in Cambodia, where parliamentarians from across the Asia-Pacific are meeting to discuss how health systems can better prepare for a changing climate. And for more, we're joined by Michelle Isles, CEO of Climate and Health Alliance. She joins us from Phnom Penh. Michelle, thank you for joining us. Now, when people hear climate change, we think about the impact on the environment rather than our health. But we're now starting to look at it more as a public health problem, especially for us here in Asia Pacific.
Absolutely. Climate change is indeed a health issue, and health leaders across our region are experiencing the impacts of climate change daily. We've just talked about some of those shocks and stresses, from the typhoons to extreme weather events, and of course, here close to the equator, extreme heat, which impacts the health and well-being of communities and puts pressure on the health system to be able to care for those communities.
Now, you mentioned heat there. What does prolonged exposure to higher temperatures actually do to our bodies, and who is most vulnerable?
Yes, thank you. So extreme heat and also experienced over time and can have significant pressure on our essential organs. Children and elderly are very susceptible, as are women who are pregnant and experiencing other health concerns. Extreme heat, but also the humidity that we experience here can cause premature death. And we've been looking at both the evidence and the experience in our health systems of what this can mean. So staying cooler, staying out of the heat is going to be necessary for both survival and for health and well-being. But that's difficult for a lot of the populations that work outside and that need to be in the heat to move around.
Well, aside from direct effects of the weather, we're also seeing concerns about diseases like dengue spreading. So how is climate change changing the kinds of infectious diseases that we have to prepare for?
Yes, well, it's exacerbating existing threats. We already have the spread of disease, waterborne diseases, especially, of course, around the Pacific and water-based regions. But these storms and floods and the frequency of these are spreading these further. So being able to identify these diseases, being able to provide equitable access to vaccines to be able to prevent illness and indeed premature death are essential more than ever.
So we could have more people falling ill due to climate change or more people getting sick at the same time. So what kind of strain will that put on our healthcare systems?
Yes, absolutely. What happens in our environment absolutely impacts our populations. So our health systems, our hospitals are often already under pressure. But our primary healthcare systems, so those healthcare workers that help us in the communities, are going to be needing to do more work. They need more resourcing and investment to be able to offer the care, not only for these acute events, so when a big climate event happens or when there's a period of extreme heat, but there's also a long tail of some of these events, both from a physical point of view, but also from a mental health point of view, as communities are continually thinking about the next event that may come and that they have to prepare for.
Now, there's often the sense that tackling climate change requires governments to spend huge amounts of money. Are there measures that governments can take now that are relatively simple or cost-effective, but could make a meaningful difference to people's health and well-being?
Absolutely. So prevention is the key, and health leaders have led on prevention. That's what public health and community health is about. And we want to stop the spread of diseases, and we want to stop the extreme heats and some of these frequent events. Some of it's about governments making decisions across the economy. You know, we need a health in all policies approach. If we thought about health first, we'd make very different decisions about the way in which we plan cities, generate energy, and indeed, you know, looking at trade and other areas of our economy. So if we put a health lens first, then we can actually save lives, save funding that's needed to go into health systems. We now know a lot, unfortunately, through both lived experience and evidence of what climate change means for our communities. So we can prepare, and that's why I'm here with parliamentarians from across this region to think about some of those solutions, to tackle some of those hard problems that will save in the long term.
No, Michelle, you're at a forum where lawmakers are working towards commitments to climate change resilient healthcare systems. What concrete commitments would you like to see come out of this forum?
Well, I think it's that commitment to work across governments, to work across parliaments. So if we just focus on health systems, then we're not going to address some of those causes of climate change. For example, from fossil fuel pollution and from other impacts that drive people to experience health harms. So working across parliaments, but also working collaboratively in the region, looking at supply chains, looking at how we can mitigate some of these impacts. So if we're going to have the spread of disease through more weather events that we're experiencing already, we need to make sure that we have secure access to the medicines, to the treatment that is needed. So greater cooperation, but also that investment in prevention. We can't put the impacts of climate change on health as a secondary consideration. It needs to be considered now. And so I hope parliamentarians will go home after this 3 days with better conviction to advocate for action and investment now.
Well, thank you so much for joining us and sharing your insights. Michelle Isles there, CEO of Climate and Health Alliance. Thank you.